Hey, look what I found. Our foot model of our fixations in the foot and ankle. Here you have the total ankle replacement for people with ankle arthritis. So you see components, two metal and a poly in the middle. That for people with bad ankle arthritis. This is what we call a fibular nail. So if you have a fracture in the ankle, this rod, we drill up the rod into the fibula and then we lock it in with these screws right here. Okay, for high ankle sprains, we have these screws that go in for high ankle sprain to stabilize it. But check this out. We see a lot of patients with midfoot arthritis or arthritis in the top of the foot around your shoelaces where people come in, hey, I have pain along my shoelaces. So what it is, pain upon the shoelace, that little hump on the top of the foot, that's arthritis of these joints. It's called a mid-tarsus joint. So this very well illustrates some of the plates and screws that we use right here. That's the joint. We cut it out and we'll put these screws and plates here to hold everything together as your body heals and forms a fusion site. This covers two joints right here. This is an orthotics for people who have a collapsing arch. We go ahead and use this plate on the side. Again, the screws are used to hold everything together while the body heals after we take out the cartilage. So there's a deep look inside of a patient's foot when we have to repair things. There's a fifth metatarsal fracture. You could use these metatarsal fracture plates. These are really small. Coincidentally, these are also used in the hands. So you see these screws are really small. These are about 1.7 millimeters or 2 millimeters diameter. So that's what it looks like if you break a metatarsal and we need to put plates and screws in there. This one is a plate and screw system for what we call a Jones fracture here, or fifth metatarsal avulsion fracture. I personally like to put a screw in here, but for this one, plate and screws on the outside, it holds everything together. It does a trick, but I like to do it with small little incision and a big screw down the shaft that holds it together very well. Many ways to skin a cat. This one is a joint implant. When you have this arthritic joint right here, typically of the second, we see that on the second a lot. So what we do is we go in, we remount the bone, put this metal implant in there, the metal glides on the head, and there you go, nice and smooth. So that's what we have right here. Second metatarsal implant. Now, this is interesting. Hammer toe, some people put screws in the hammer toe. Not my preference, but people do that. This one, you have a bad arthritis in the big toe joint, not of the big knuckle, but the small knuckle in the front. I have a few patients with that. This is a staple. These are staples, memory staples. So take away the cartilage, put the staples on top, and everything gets together. This is a very good model. Has a lot of stuff that we do. This one is a calcaneal cuboid plate. So if we do a triple orthodesis or a fusion of the hind foot, we can use this on the calcaneal cuboid joint and to fuse it. Again, after you prep the joint, you put that in. So great model. We went through a lot today, and leave that here for them. This is one way of putting a plate on. Okay, although I see this more in staples. This is how we align things to screw into the bone. There's a drill guide, drill into the bone. That's more for a staple. 18 millimeters wide, staple. So you put this against the bone, right here, drill, and then you hammer in the staples. Works really well. See what other kind of toys we have here.